In this video, we will talk about dengue fever in detail. Dengue fever is a mosquito-borne tropical disease. It is caused by dengue virus. It is also called break-bone fever as it leads to muscle and joint pains. Dengue is spread by several species of female mosquitoes of the Aedes genus. However, commonly it is spread by Aedes aegypti. Aedes aegypti usually lays its eggs in artificial water containers to live close to human beings. Dengue serotypes. There are 4 dengue serotypes. Infection with one type usually gives lifelong immunity to that specific type, although it gives only short-term protection to other types. Humans are the primary host of the virus. Dengue can also be transmitted by infected blood products. Symptoms typically begin 3 to 14 days after infection, and recovery generally takes 2 to 7 days. When mosquito carrying dengue virus bites a person, the virus enters the skin together with mosquito's saliva. Virus interacts with white blood cells and reproduces inside the cells. The white blood cells respond by producing cytokines and interferons that are responsible for symptoms such as fever and severe body pains. Severity. In severe infection, the virus production is greatly increased, and organs such as liver and the bone marrow may be affected. Dysfunction of bone marrow leads to decrease in number of platelets, which ultimately increases the risk of bleeding. Up to 80% of people infected with dengue virus remain symptom-free or have only mild symptoms. The characteristic symptoms of dengue fever are sudden onset of high-grade fever, headache that is typically located behind the eyes, muscle and joint pains, and rash. Clinical course of dengue fever. The course of infection is divided into 3 phases: febrile phase, critical phase, and recovery phase. The febrile phase. In this phase, there is high-grade fever, generalized pain and headache. Along with this, there is nausea and vomiting. Rash is seen in 50 to 80% of patients, and there may be petechiae. Critical phase. There is leakage of plasma from the blood vessels. This may result in fluid accumulation in the chest and abdominal cavities. Consequently, there is depletion of fluid from the circulation. This leads to decreased blood supply to vital organs. Moreover, there may be severe bleeding, especially from gastrointestinal tract. Dengue shock syndrome. Dengue shock syndrome and dengue hemorrhagic fever occurs in less than 5% of cases. Note that previously infected individuals with other serotypes of dengue virus are at an increased risk of developing severe symptoms. Recovery phase. There is resorption of leaked fluid into the bloodstream. This phase usually lasts 2 to 3 days. A maculopapular rash may occur at this stage and followed by peeling of the skin. At this stage, fluid overload may occur which may affect the brain. Consequently, this condition can lead to decreased level of consciousness or even seizures. Warning signs. These are the warning signs in dengue fever: worsening abdominal pain, ongoing vomiting, liver enlargement, mucosal bleeding, high hematocrit with low platelets, lethargy or restlessness, and serosal effusions. Now we will talk about diagnosis. The earliest change detectable on laboratory investigation is low white blood cell count, then low platelets, and after that raised LFTs, that is raised AST and ALT. And next you can see plasma leakage leads to hemoconcentration and results in rising of hematocrit and hypoalbuminemia. Dengue shock syndrome is seen if pulse pressure drops to less than or equal to 20 mm of mercury along with peripheral vascular collapse. Other laboratory tests include virus isolation in cell cultures, nucleic acid detection by PCR. Viral antigen detection can be done by NS1 and through antibodies. Virus isolation and nucleic acid detection are more reliable tests than antigen detection. However, we can perform some easily available tests which include NS1, dengue IgG, and IgM. Both IgG and IgM are produced after 5 to 7 days. IgG is a useful indicator of past infection, while IgM represents acute infection. Now we will focus on prevention of dengue fever. Get rid of open sources of water where mosquitoes grow or by adding insecticides to these areas. Wear clothing that fully covers the body. Moreover, you should advise about mosquito netting and application of insect repellents. Next comes the vaccine. The vaccine is only recommended in individuals who have had prior dengue infection or in populations where most of people have been infected by age 9. Note that in those who have not had a prior infection, there is an evidence that it may worsen subsequent infections. Next comes management of dengue fever. There are no antiviral drugs for dengue fever. Treatment is only symptomatic. Patients who have no warning signs and are healthy can be managed at home, while patients having severe disease should be admitted in intensive care unit. Invasive medical procedures such as nasogastric intubation should be avoided in serious patients. Paracetamol is used for fever and for body aches. Blood transfusion should be started in patients having unstable vitals or decreasing hematocrit. Platelets transfusion may be considered in severe thrombocytopenia, that is when less than 10,000, or if there is evidence of bleeding. Role of corticosteroids is controversial in dengue fever. Moreover, during the recovery phase, intravenous fluids are discontinued to prevent the fluid overload. Thanks for watching.